Jowls, the silent sinkholes of the face. You wake up one day and something feels heavy. Your reflection looks bottom heavy, pulled, unfamiliar. That's jowling, the most misunderstood, most mismanaged marker of facial aging. And it's not just aesthetic, it's anatomical, inflammatory, and bioenergetic. Jowling isn't just loose skin, it's the visible endpoint of facial structural descent. Three key systems collapse over time. The bone, maxilla resorbs, mandible retracts, the fat, deep and superficial fat pads deflate and migrate. Infraorbital, malar, buccal fat pad, they all descend. And the skin, the dermal matrix weakens thanks to UV damage, cortisol stress, estrogen decline, and mitochondrial dysfunction, deflating like a balloon. The skull resorbs, fat pads migrate, muscle and ligaments weaken, the skin deflates, everything slides down, thus the dreaded jowls form. It's a cascade, it's not a single culprit. And there isn't just one type of jowl, there are many. Understanding anatomical planes and diagnosis is key. If we look at structural collapse, bone resorption and ligament laxity. If we look at volume shift, mid-face deflation and buccal fat descent. If we look at skin thinning, dermal collagen degradation and hormonal skin fragility. Now be careful, stop chasing trends. For example, buccal fat pad removal results in guaranteed premature aging with worsening jowls. They look cute for the moment, but not when you're older. Over-aggressive radiofrequency, this results in deflated balloon by destroying these fat pads needed for skin to hold on to. As always, with BDV, we assess in 360 manner with an inside-out approach on all anatomical and end organ function planes. Bony resorption, we can support with biostimulators such as calcium hydroxyapatite, PLLA, or hyaluronic acid. We can restore fat scaffolding with fat pad remodeling, either with machine-based modalities such as ultrasound, RF, lasers, or interventions with surgical threads, or removal of the fat pads, or even fat transfer. We can trigger collagen with neo-collagenesis with injectables or medical machine modalities. My favorite is Thermage. We can use hormonal biomarkers to profile collagen loss and metabolic age. We can look at systemic anti-inflammatory reset with things like EBU or TPE. And of course, we can use regenerative anti-aging with IV exosomes or mesenchymal stem cells, and peptide stacking for dermal regeneration and skin resilience. How I personally approach it? In a multimodal manner, like everything at BDV, from an inside-out approach. I personally use IV stem cells annually or biannually, exosomes for cellular regeneration. Then I use our patented in-stimulothermothorax with exosomes protocol to tighten my skin, all aspects of my body, because skin is the biggest organ. Then I use biostimulators and hyaluronic acid on the periosteum deep without causing volume every 1 to 2 years for definition and lift and tightness. The face is a living structure, and jowling is your tissue's way of asking, are you listening to me? Don't chase tightness, chase resilience, regeneration, and corrective restorative proportions. And go to someone who knows what they're doing.